play a key role in sharing our story with your social groups, colleagues, family members, neighbors, and more, and we invite you to do so. With a virtual model, you will be able to send a link to those special people in your life and invite them to view this event with a simple click of the button. Also new this year is Text to Give, and you'll be hearing more about that later. But now, I would like to recognize our sponsors. These organizations have all played a key role in our success, and we appreciate their generosity. Our patients, staff, and board, thank you. Over the years, we have also had the support of many individuals and organizations that have furthered our mission through their vision, leadership, and collaboration. Since our 25th anniversary in 2017, we have presented two special awards, the Founders Award and the Leadership Impact Award. The Founders Award recognizes an outstanding contribution of an organization or individual who has had a lasting impact on the health and wellness of the communities we serve. The Leadership Impact Award recognizes efforts of an individual or organization that has advanced the mission and philosophy of Health Partnership Clinic. In addition, this awardee brings leadership expertise in the promotion of HPC, healthcare, and wellness. Today, I am pleased to recognize Dr. Nevin Waters with the Founders Award. Dr. Waters is a former board member and dental director. He is singly responsible for laying the foundation of our dental services. Under his capable leadership and direction in 2002, he secured donated mobile dental equipment and forged partnerships with the UMKC Dental School and Johnson County Community College to provide volunteer staff. Today, dental services are provided to both adults and children, inside and outside of our walls. Dr. Waters continues in private practice with his daughter here in Olathe. Congratulations, Dr. Waters. Last week, we had an honor to present the 2020 Leadership Impact Award to the Olathe Fire Department. In 2015, Olathe Health, the Olathe Fire Department, and Health Partnership Clinic established a mobile integrated health program. The team includes a health partnership nurse practitioner and a firefighter paramedic. Together, we have worked diligently to provide direct patient care with same-day appointments and chronic disease follow-up care to reduce overuse of the emergency room and 911 services. Because of this innovative program, we have been able to help thousands of underserved Olathe residents who are frequent 911 callers, people with chronic diseases, older adults, or disabled individuals trying to live independently. The team also works with individuals who are experiencing homelessness and school-aged children. We are thriving today because of people like Dr. Waters and Chief Jeff DeGraffenreid and the Olathe Fire Department staff. Thank you. I promised you'd hear more about our clinic through the eyes of our patients and our clinic staff. So I invite you to sit back and enjoy opening doors, embracing new opportunities.
My health is important because I have 6 grandbabies. I want to live to see them get married and walk across the stage in graduation, and me being healthy is important.
Everyone deserves quality care. We focus on quality measures, and it is ingrained in everything we do. We care what our patients think. We want their patient experience here to be as good, if not better, than anyone else's in this community.
We are essentially the foundational portion of the safety net as far as healthcare that our patients receive. We do not turn patients away We are always here for patients regardless of their needs.
Health Partnership Clinic has invested significant resources in being able to provide integrated services to our patients. What that means is when an individual comes to Health Partnership Clinic, they get far more than primary healthcare services. We are really striving to take care of the whole person and being that one-stop shop for our patients.
When they see how serious we are about performing well, the patient then feels reassured that we're taking care of them.
Health Partnership Clinic has always embraced new things. This is our way of staying abreast of the best quality of care that we can bring to our patients. This ranges from whether we're asked to start a new school-based clinic to working with a pediatric practice to ensure that their patients continue care with us once, say, a provider has retired. One of the key areas where we've risen to respond to the need is with the opioid crisis. From growing our behavioral health staff to also adding substance use disorder treatment, group counseling sessions, but now also adding medication-assisted treatment.
We use FDA-approved medication treatments to help patients who are dependent on substances, to help them stay off of those substances and at the same time help keep them out of withdrawal.
I just knew something had to be done because if not, I was headed probably for a lot of destruction when it comes to this disease.
So we'd recognize that in our community we do have a high proportion of patients who have diabetes, and it was difficult to control them just in one of those quick 15 to 20 minute visits. And also it's known that with diabetes, it's a multifaceted disease. You need not just medication, but you need education, you need support and counseling. It is going to be with them for their life. And so there's just more intense treatment that's needed.
Today I got good news that it's at 9. It's not where it should be, but it is going down. And it's due to the fact that I don't have to worry about the medications because I get them free through the program.
So this is a major benefit that helps break down barriers for our patients because we know that one of those barriers is access to expensive medications like insulin.
I have everything I need, so it's up to me now to do the work.
The mobile integrated unit is a perfect example of taking our services to meet the community where they are. It also highlights what federally qualified health centers do well, and that's partnering. Partnering with the fire department is a natural fit for us to go out into the field, to see people, to meet them where they are, and to provide services.
The mobile integrated team gets healthcare and other resources to people in the community that might not be able to reach it otherwise. So we'll do history and physicals for adults that need them. We'll do history and physicals for kids in the schools if parents are unable to get them into a clinic or don't have the finances to put them into a clinic. And there's some people that we see that are experiencing homelessness or recent changes in family dynamics, people that are new to Olathe or new to the country.
A Health Partnership Clinic is really an important place to provide the dental home, especially for those who have Medicaid. There are very few dentists who accept Medicaid. And so as one of the only providers here in Johnson County, that's, a home for these, people to get the care and get really good care. We have several dentists here that provide the care, and myself as a pediatric dentist, I can bring that service to children who would not otherwise have that access. So we actually go into the schools, do screenings to determine kind of what's needed, and then also work on prevention.
So at Health Partnership Clinic, we follow an integrated behavioral health model, which means that our behavioral health clinicians will come in during a primary care visit, whether it's pediatric or adult. It's a short visit and it does not include individual therapy. It's a brief assessment and some brief interventions to help prevent and then manage any stress or mental health issues. We have a partnership with Heartland Radack, who provides us a licensed addiction counselor on site at our Olathe clinic 2 days a week. And we're really excited to be able to offer ongoing outpatient substance abuse services. And what that means is they'll meet with an addiction counselor once a week. We also have a group that patients can attend as well. And the most important thing is that we can provide access to care. So regardless of ability to pay, patients are able to access those substance use services.
I think the most critical action that we took was to always make sure that we were here and that we were open. One opportunity that came up that really helped us stay open and be there for our patients was the move to implement telemedicine here at Health Partnership Clinic. So there are other technologies that we're always looking at. We are working with United Healthcare Group to pilot being accessible to an Alexa type function.
I found a few doctors near you. The first one is Health Partnership Clinic,
where patients can find out how to make an appointment with us. So when it comes to partnerships, when it comes to technology, when it comes to the diversity of our staff, there are always new opportunities. One designation that we're very proud of at Health Partnership to have is that of the patient-centered medical home. That is a designation that recognizes all of the efforts that we make to ensure that the patient is taken care of.
The community helping spread the word about Health Partnership Clinic. That is a key way in which they can spread our mission, to make sure that we are known so that people that need our services can come to our doors.
It's very important for me to be able to have a health partnership in this community to help me with my health issues, because if not, I don't know what I would do.
Hello, everyone. My name is Barbara Lech, and I'm a patient at Health Partnership Clinic. I first came to HPC in 2012. I had become a caregiver for my elderly mother in 2009, a year after my father died. I had been caring for her and working full-time in a multi-use call center. In June of 2012, my employer eliminated my position in anticipation of moving the call center overseas. I lost my health insurance and had several prescriptions I needed to refill. I was a mess, and my brother hauled me down to KU, where I received a checkup and referrals to have my scripts refilled. They also provided a list of clinics where I could receive ongoing care on a sliding scale. HPC was one of the clinics. I called and made an appointment, and it proved to be an excellent decision. Now, just to give you a little of my background, I graduated from college with my BSS in theater, public speaking, and secondary education in 1978. Soon after, I accepted a contract to teach ESL in Fukuoka, Japan. It was an amazing experience, and it certainly broadened my outlook on the world. After Japan, I decided to earn an associate's certificate in travel and tourism. I worked for several companies, including Hertz Worldwide Reservations in Oklahoma City and AARP Travel Service in Kansas City. Through a series of layoffs and failure to find a full-time job, I eventually ended up with 3 very different part-time jobs and taking graduate classes at KU. That led to me managing a shoe store at the newly built Mall of America in Bloomington, Minnesota in the early 90s. Things were going well for me. But all that changed in 2001 when I severely injured my back. After 9 months of surgery and rehab, I returned to work for about 3 months, only to lose my job because I could no longer do the physical work it required. So after 13 years, it was time for me to start over again. While working for a temp service, I landed a position with a call center and worked my way up to quality manager. During this time, my father's health declined, and eventually in April of 2008, he died. And my mother was on her own. I stepped in to help with shopping and other errands. A year later, she was hospitalized. When I brought her home, she asked me if I would move in with her so she could stay in her home. I mulled it over and finally agreed. It wasn't easy living with my mother after being on my own for so many years, but we rubbed along. And as she became more ill and infirm and less able to do things on her own. In June of 2012, my company let me go. And since mom needed me more than ever, I didn't look for another job. This time was hard for me as I was fighting my own health problems of diabetes, high blood pressure, hypothyroidism, depression, and my bad back. We both missed Dad a lot. Our health was spiraling out of control. I turned to HPC. A year later, my mom discovered a lump in her breast. She didn't want treatment, and months later, she was gone, and I was devastated. During this time, HPC was my lifeline. I don't know what I would have done without the clinic staff. Here I was, mom gone, my blood sugar and thyroid all out of whack and severely depressed. I had no income, and my brother was itching to get the house sold and me out. Gwen, who also goes by Dr. Wagner and is an adult nurse practitioner, and Cecilia Ponce, a social worker and behavioral health clinician, pulled me through with good counsel, support, and caring. I did a lot of crocheting during those months and donated all my creations to Health Partnership's pediatric patients. I believe the love I put into them is like giving each child a warm hug. 2 years ago, I joined HPC's high-risk diabetes clinic. My hemoglobin A1C was 9%, too high. After education, regular monitoring, and support, I'm now at 7%, a huge win for me. I also credit Gwen with saving my life. Last summer, I experienced spells of bleeding, but never thought to share it with my doctor. At my last appointment, I mentioned it to her. Gwen quickly scheduled an ultrasound and a mammogram, and that led to a biopsy and a diagnosis of cancer. I had a hysterectomy on September 12 and learned that I had 2 cancers, endometrial and ovarian. My care plan was to undergo chemo. Unfortunately, the first day of my chemo didn't go very well. 30 seconds into the first drug, I went into anaphylaxis and ended up in the hospital. It was discovered that I had an infection due to my port. After IV antibiotics and a new PICC line installed, I started chemo the week of Thanksgiving. The rest of chemo went smoothly, and I was cancer-free by March. I have 2 coping mechanisms: daily laughter and prayer for others. It has kept me sane through all this craziness. I'm so grateful to Gwen and HPC. She's my doctor for life. Today, I stand before you, cancer-free and coping the best I can with the pandemic. Since I'm an at-risk person, I isolate, use plenty of hand sanitizer, and always wear my mask. I continue to crochet and read, and I know HPC is just a phone call away. All sorts of people from all walks of life enter HPC's doors every day. No matter our backgrounds and situations, HPC has been there for us. Your donation and sponsorship help people like me receive the care they need when they need it. It's affordable, and being on a limited income, that's huge for me. As you can imagine, I am still paying for my hospital and treatment costs. Knowing I can come to the clinic, access affordable primary care by supportive providers and discounted medications provides me with a sense of relief and peace. Bottom line, It's life-saving. Thank you for making a difference in my life and so many others.
It is a pleasure to be with you today. My name is Wael Murad, and I serve as Chief Health Officer here at Health Partnership Clinic. Today, we will share what are some of the underlying factors for healthcare disparities, a personal story to illustrate those disparities and those factors, and how Health Partnership Clinic is part of the solution. 80% of all health outcomes are due to social factors. Social factors such as a person's zip code. A zip code, which is nothing but a numeric designation of where people sleep at night. That code is a greater predictor than a person's health outcomes, even more so than their genetic code. How did this happen? Well, we can conjecture as to why. A couple of months ago, my wife and I took an audio tour of the Kansas City metro area. We started off at Shawnee Mission West High School and ended the tour at Central High School in the urban core of Kansas City. And all in between, we saw a number of beautiful houses that harken to the early days of Kansas City. We meandered and weaved back and forth past the state line until we finally approached that rapid gradient from high development to low development, which is Troost Avenue, a stark demarcation between two racially homogenous communities, and a legacy of previous redlining, exclusive homeowner association clauses, and efforts by the Homeowners Loan Corporation and Federal Housing Administration to differentially provide financial credit to families and individuals based on race. We learned that differential allocation of financial credit leads to disparities in local investments, which then leads to disparities in long-term spending and income. Research shows that residential segregation, along with wealth inequality and decreased investments in pockets of communities, has a fundamental link with increased health disparities as well as decreased life expectancy. We know of zip codes in the Kansas City metro area that have the lowest levels of income and asset value levels, and we know them to be hotspots for adverse health outcomes such as low birth weight infants, childhood cases of lead poisoning, preventable cases of hospitalization due to asthma, as well as decreased life expectancy. Also, there are discrepancies in the opioid crisis, with some communities affected more so than others. What is clear is that healthcare disparities affect all peoples. The starting and ending points for that tour were very interesting choices. Both were public schools, but they represented very different stories of development. We saw the consequential link between a zip code and property value, and between property value and property taxes, and between property taxes and funding for local education. And this is very significant. The long-term economy or the long-term GDP of any community or society over the long run is directly proportional to productivity growth. Productivity is how hardworking, industrious, and inventive someone is. Two critical underlying factors for productivity include healthcare and education. When there are disparities in healthcare compounded by disparities in education, that leads to disparities in long-term productivity, which then leads to disparities in economic growth, Those disparities in economic growth then perpetuate a vicious self-reinforcing cycle of healthcare disparities. Life is hard. Life is hard for everyone. And as we all know, sometimes we need as much help as we can get just to make it. The environment around any one person is enormously important in determining how much help that person gets. You can think of a person's environment as a number of concentric circles around that person, with the outermost circle being that person's society or country, and the innermost circles representing that person's city or neighborhood until you get to that person's family. That constellation of circles, those constellation of circumstances pave the path for that person's trajectory. And then it's up to that person to make the most of that trajectory. Any barrier, any change in circumstances for that person can then alter their trajectory. Research shows that psychosocial trauma and chronic stress has a significant association with increased cortisol levels, which is the body's stress hormone, and as a result is associated with its deleterious effects such as increased blood pressure, increased blood sugar, and increased complications due to chronic disease. Also, chronic stress can pressure people into a corner where they exhibit maladaptive responses and maladaptive behaviors to certain situations. Why is this important? I can remember when I was in high school, my mom came home one day in our upper middle class neighborhood, and she saw someone rummaging through our mailbox. And she asked that person, "What are you doing?" And that person, without turning around, said that he had to kind of look in there to see what these foreigners are up to. My mom, she told that person that, well, she lives there and her family lives there. And without saying anything else, without turning around, without an apology, that individual left. In the early 2000s, my 20-year-old sister was killed during a robbery during a trip abroad in Egypt. Now, she and the rest of her family were all US citizens, but originally from Egypt. And despite the fact that we knew who the perpetrators were, we were unsuccessful in securing the support of the US Embassy and our local and state politicians in pressuring the Egyptian authorities to investigate thoroughly and bring the perpetrators to justice. On the one hand, the Egyptian authorities were saying how they literally cited the fact that, well, she's not from there, she's foreign, and literally cited that as a reason to not investigate further. On the other hand, the US Embassy literally cited the fact that this was soon after 9/11, and there really wasn't a lot of political appetite to investigate these matters thoroughly. We had ties and connections to both places, but we were seen as foreigners in both places. We came home from the most traumatic trip abroad that we could imagine, and it was something that we could hardly believe. When we returned home, there was a newspaper reporter snooping around our property. He never asked any questions of my parents, and we learned that he was looking to publish a story in our local newspaper about how this family traveled abroad and killed their daughter. This was shocking, to say the least. Fortunately, no such story was ever published, and we moved on and we grieved on our own. Around that same time was the Natalie Holloway case. You might recall, this is the story of an 18-year-old who disappeared while in Aruba. Her disappearance mobilized Aruban investigators, FBI special agents, the Dutch Air Force, and the vocal support of local and state politicians. Double standards are hard to swallow and may contribute to trauma. My mother became depressed. She was prescribed antidepressants that she did not take. She let her diabetes get out of control, but she did her best for her other kids. And it's lucky for us that she did. We were fortunate to have parents with the background, with education and resources, with the grit to impart to their kids so that we could move through this difficult chapter. And I can assure you, had it not been for that, we would not have made it. My mom eventually got her diabetes under control. She lost weight, and now she's there for her kids and her grandkids. We did, after all, live in the right zip code. What do I take away from these experiences? Well, no one likes a double standard, firstly. Secondly, those who experience trauma carry it with them for a lifetime. And thirdly, their health is directly impacted by that trauma. Often, it takes all that somebody's got just to make it. And often, people do not make it. If someone were to see an injured person go through an obstacle course, would you say that it's that person's fault if they don't make it? And it's possible there may be some truth to that, but surely we're capable of more humanity than that. And it is up to everyone to aspire to care for other people. At Health Partnership, we do not have double standards. We serve all. Federally qualified health centers like Health Partnership are community-based organizations that provide medical and preventive health care, oral health care, and behavioral health care. We are an integral component of the healthcare system in the United States. We are governed by a community board, and we see all patients of all backgrounds. We screen patients for trauma, we screen patients for depression, and we screen patients for suicide. We counsel patients on their weight. We have stepped up in the wake of the COVID pandemic to initiate testing for our patients and staff, including the Hispanic community, which has been disproportionately affected by the pandemic. We have initiated telehealth services for the first time in Health Partnership's history. And we have upgraded our facilities in order to protect our patients and our staff. We are aggressive in the management of our diabetic patients with our high-risk diabetes clinic. We have kept up with a national movement to increase treatment for opioid addiction with the establishment of our medication-assisted treatment and substance abuse services programs. We are providing greater access to patients with our increasingly efficient schedules. At Health Partnership, we are poised to take care of all who come through our doors. For those who hail from the beautiful farmlands of Miami and Franklin counties, to those from the immediate vicinity of our hub here in Olathe, for those from elsewhere in Johnson County, or even Wyandotte County, or even Lawrence, or even just across the state line. As we strive to serve our communities, we are so grateful for the support that we have received in return. From supplies such as hand sanitizers and personal protective equipment, and even refreshments for our staff that increase our morale. As you can see, we've packed a lot in these last 30 minutes. We hope that you have a better understanding of Health Partnership and are inspired by our work. As we have demonstrated, the need is great and it is growing. We need your financial support during these difficult and challenging times. As we continue to navigate through the COVID pandemic, our doors will always be open to our patients and the community. We are that beacon of light for when our patients' worlds fall apart or collapse because of the burden of job loss or poor health or social isolation or addiction issues or financial trauma. And for those with trauma, we want to be that resource to help them make it too. Added to this, Medicaid expansion has stalled. Although the world seems bleak, there is hope, and it is up to you, and it is up to me. It is my privilege to ask to please consider giving to our clinic. There are several ways to do so. This year, please try our new text to give function. Also, we would welcome visitors to our website at hpcks.org, where an online gift can be made, or you can provide a check. Any gift is appreciated, and we can assure you it will make a tremendous difference. Thank you.
This concludes our first live and virtual Opening Doors benefit. Thank you for joining us today. Be safe and enjoy the rest of your day. Thank you.